Welcome to the final installment of our caregiver training for CaraSolva. Just have a few miscellaneous items to finish up with. And the first thing I'd like to kind of highlight have to do with some items that I missed first time around, specifically around alerts. So I'm on the prompt screen here for Bob Johnson, and you'll see here all these red ones. These are overdue alerts, as we talked about. One nice benefit that CaraSolva has is that it has the ability to send out a prompt or an alert to individuals if the system's set up for that, prior to these individuals going red. And so as we have medication, it has a 2-hour window, so a 7 o'clock medication will go red at 8 o'clock. At 7:45, an alert will go out to the nurse associated with that location. And they may, if they see that, be able to call you in time and say, hey, can you go ahead and pass this or do this quick so that it's not outside the window. That may happen from time to time, but our nurses are going to use that more as a quality assurance type tool because they don't always have their phones with them, they don't always have their phones on or are looking at it waiting for something to come up. And so you may get a phone call out of the blue from time to time from a nurse saying, hey, you've got something you need to do. But for the most part, that's going to be a quality assurance thing. It'll flag them as something that needs to be followed up upon, or to be able to call and talk to you and say, hey, what happened? Why were we outside the window with something that was in there? Also, I do want to note that what has been given an alert is kind of at the discretion of the nurse consultant assigned to the home. And so some medications have alerts and some won't. It kind of depends how serious and important that particular item is. And so there may be things that go red that they don't get an alert for and some things that they do. If you have any questions with that, feel free to let me know. Like I said, it's more of a quality assurance type thing rather than a backup or support. One other thing regarding treatments, and as you've seen here, in addition to the medications, we also have some regular vitals, or we have some vitals associated with medications as well as treatments that are ordered by a physician. Now, some of those treatments are not administered by the MedPasser at your sites, and so what we expect to see as far as regular use is that we're going to have multiple people needing to come in and use CaraSolva on every shift. And so for all your doctor-ordered treatments, those types of things, make sure that you're coming in here and documenting those as they happen or as they're assigned within the window. The majority of those treatments, unless there's a reason for it to be given at a certain time, we picked the time to give them, and we gave it a very wide window to account for the fact that when people get up and have their cares done, sometimes changes significantly from day to day. So the window, instead of being 2 hours, an hour before and an hour after, like medications are, maybe 4 or maybe 6, and some may even be for the whole day. And so it just kind of depends on what the treatment is and when it needs to be done. But just to highlight, even if you're not the MedPasser, you're still going to have a need to come in here and take a look at the prompts and things that are due for that individual you may be supporting for the day and make sure those get accounted for and documented on here in the system. Now, one of the things, and this has been a hang-up for us and kind of keeping us from making a move to CaraSolva sooner than we are currently, and that is we now have 2 systems in which we are going to document health information on the individuals that we support, CaraSolva and Therap. As you can see, the interface here is pretty simple. It's very user-friendly. I think you'll find it very helpful as you go through and work to document on your medications and tasks throughout the day. But we are going to have some times when we're going back and forth. And we talked earlier about with the bowels and how we support that. We're going to need to document all of our bowel results and elimination results in Therap and intake and elimination module like we always have. But you'll find the bowel protocol and your intervention documentation in CaraSolva. And so we will have to go back and forth between those two, because in order to rectify that, we'd need to buy a whole other section of CaraSolva in order to be able to do that. And those interventions are medications, so they have to be documented here in CaraSolva with the rest of our meds. Other places that we're going to have some go-between have to do with our weights and vitals. I mentioned before that with our vitals, anything that is attributed to a medication, as you can see on the screen here, blood sugar being a great example, this may prompt us how much insulin we may need to give a person at certain times of the day, and so we'll have blood sugar in here. If we're just doing a generalized blood sugar check, that wouldn't go in here if it's not associated with a certain medication. Things that are just regular, routine things that we do, like our monthly weights, we do some blood pressure monitoring for certain individuals. If it doesn't have an impact on a medication, that will still get done in therapy. To include any time that a nurse calls and says, hey, I'd like you to do some vitals, take a person's temp, blood pressure, respiration count, that type of stuff. That's all going to stay in and be documented in therapy. The other place for crossover has to do with our appointments. There is some space in here to do documentation on appointments. We're not going to utilize that at this point in time. We're going to continue to do our documentation for appointments in therapy. One thing that we're going to lose as we make this transition is that our medication information isn't going to be in therapy any longer, and so an individual will need to come into a person's prompt page, go to other reports, and click on home medication report to be able to get that list of current medications to take with them. This is where we're eventually going to go with it. You will continue to have the physician order sheet in the health information manuals, which you can take with on your appointments, and that should have all the accurate medications for an individual at any point in time, and the physician's office or hospital should be able to work off of that. The idea is once we get going, is we hope to see that what we have in CaraSolva is more up to date than the POs, and those physician orders may go away, and at that point we're going to rely on the home medication report to be able to present and give information to those different healthcare providers. A couple of follow-up things. As we finish up here, there is, as with everything, there's going to be a competency base to show that, hey, you've gone through the videos, you have an understanding and a comfort with the system. And so what I'm going to ask everybody to do after you finish watching the videos is to come in and document on at least 10 items here. Make sure that there's at least one medication, make sure that there's at least one narcotic, and that you've got at least one treatment or vital in here to document on. And so I'm going to go ahead, and it shouldn't take you very long. You don't actually have to test this for anybody. It's just purely make sure you're comfortable with the buttons. And so for blood sugar, put 153 in here, mark that as successful. This one too. For diazepam, as just a reminder, we got to put our count in. Oh, I'm going to give 2 tablets by mouth 4 times daily. So I'm going to end up with 11. After that, I can skip the approved by because we don't utilize a witness. Successful. Here's my pummel vest. Here's a treatment. Here's another treatment with the neb. We'll go ahead and do a blood sugar test. These obviously aren't accurate blood sugars. And so as I come down, I've got, let's say I have 10 of them here. I'm going to click on Administer All Checked. Oh, I have time for a little while. And now it won't remember all the stuff that I just documented on that page. And so because I did that, I'm going to need to come back in, and all those things that I just did, I'll need to rekey. And so what happens when you time out is rekey all of this stuff. And so like I said earlier, that won't happen except for 30 minutes of inactivity. I'm doing a redo on this last section, and so that's why it's been so long. And so if I put these, I've done several of them. If I administer all checked, it'll reload. All those items will go away. Now, one thing to mention that I didn't mention earlier is that once they go away like that, you can't pull them back up and adjust them. If you have any concerns or documentation that needs to get changed or adjusted or something that you didn't do quite right, you'll need to send a message, go over, send an SCOM to your nursing manager and explain, hey, here's what happened, here's what needs to get adjusted, and then they can come in and they have some override privileges that they'll be able to come in, make that adjustment on the final record. But you won't be able to come in and do that yourself. Once you've done your 10 items here, I would like you to come in, go ahead and do a PRN, put your remarks in, put that as active, and then finally the last thing that I'll ask you to do is there is a competency quiz that's being sent out. It's 9 questions, multiple choice, true, false. I would ask that you go through that, fill it out, and give it to your manager. Along with that, there will be a signature page with CaraSolva, something that that Therap doesn't, is it allows us the ability to put your personal signature and associate it with your profile and your initials. And so with the competency quiz will come a signature page. I'll ask you to sign 4 times on that signature page and then write your name in legibly so I know who to associate it with, and turn that in with the competency quiz, and we'll go ahead and take one of those signatures, the one that comes out the best, and associate it with your profile. If you could please do that and hand that in to your manager. You'll need to do that before you'll be cleared to go ahead and start documenting here in CaraSolva. So with that, that's all that we have at this point. I do want to say thank you very much for sticking with us through the videos. We are going to go through a period here where we'll continue to evaluate how things are going, what's working, what's not, and kind of like Therap, we'll continue to make adjustments as we go based on that feedback, and we may look to expand this and what we use in it over time. We want to start small, and we'll kind of build into it as we find the best balance between CaraSolva and Therap for us to be documenting and recording people's healthcare information. If you have any feedback regarding the training or questions regarding anything that I've covered here today, feel free to give me a call, let me know. Otherwise, utilize your nurse consultants and your program managers to help guide you through any questions or bumps that you may find. Thank you very much, and have a nice day.